Hello my people, this is Mwanguzi Shadrack, your doctor from Health Touch Uganda. Today I'm going to be talking about the symptoms or simply the things you feel in your body in case you have high glucose levels in your blood, a condition we also call diabetes mellitus. If you've not watched our earlier messages on diabetes mellitus, I request you to go and look them up so you get a clear understanding of whatever we are talking about even in this video. You can check up our YouTube channel and look for all those videos, but you can also visit our Facebook page. The same videos are there. Feel free to like all our social media platforms, Instagram, Twitter, or join any of our WhatsApp groups for quicker access to our information. So in case you have diabetes, what are some of those things that will alert you, that you will feel in your body and are supposed to send you to hospital to go for a blood sugar checkup? Most of the people, like I told you, fall in the two categories of type 1 or type 2 diabetes mellitus. But because they all cause the same thing, making your blood sugar high, you will feel the same things regardless of the type that you have. The only difference is for people with type 2, you may not get these symptoms in the early stages of the illness. You may even take up to 4 years when your blood glucose is slightly high, but you don't have the severe symptoms like the way these people in type 1 get, but they are the same. So what are some of these things? Number 1, you feel you want to urinate all the time. You find you even wake up in the middle of the night 3, 4, 5 times just to urinate. So if you are someone that urinates frequently, maybe like every after an hour or 2, you want to go to the urinals and ease yourself. That is not normal. It is most likely to be diabetes, in as much as it can also be caused by other things. So don't settle until you have your blood glucose measured to find out if it is not diabetes causing you to frequently go to urinate. Other people feel thirst all the time. You drink water now, in about 30 minutes you want to take more water. You even wake up in the night feeling so thirsty and you go look for water. If you don't get that water on time, you feel so bad, your lips dry up, you feel terrible. It's one of the things that communicate to us that most likely you have diabetes. Other people feel hungry all the time, and because they feel hungry all the time, they also eat all the time. 1 hour following a meal, you feel you need to eat something. So if you are someone that frequently eats, not because you are greedy, but because you actually feel real hunger, it is important to go and get your blood sugars measured, because it might actually be diabetes mellitus. Some people feel abdominal pain. If you're the kind of person that always feels abdominal discomfort, abdominal pain, usually the pain can be found in the right upper part of the abdomen. Sometimes it might be due to diabetes, in as much as it can as well be due to other things, but you can't really say you don't have diabetes if you have that kind of thing. Other people feel general body weakness. All of a sudden you feel weak, you can't do much. It's not like you've been working hard, it's not like you are exhausted, no, but you just feel generally weak. Some people get a blood vision. It's daytime, there is a lot of light around, but you have a blood kind of vision, you don't see clearly. It might be an indicator that you have diabetes mellitus. Some people feel numbness in their feet and hands, and others feel pricks, like pin pricks in the feet and in the hand. Those are all symptoms of diabetes. When you have diabetes for a long period of time and don't do anything about it, your immune system gets weak. And when that happens, whenever infections that would otherwise be light infections attack you, they actually treat you very badly off because your immune system is already weak. So those are some of the things that you feel in your body when you have diabetes. I want to encourage you that if you ever feel any of them, please don't settle until you get your blood sugars measured. Remember, you have one life to live. Oh yes, one life to live. Mwanguzi Shadrach, Health Touch Uganda. Follow the light.